Hey guys, this is Dr. Hub. Today we'll look at the HLA association. So the HLA association is with the disease. So to begin with, first there is a autoimmune gut and skin diseases and HLA association. We're looking at the autoimmune gut as well as the skin diseases and the HLA associations. So first is we are looking at the gluten sensitivity enteropathy. So the gluten sensitive enteropathy. So this is nothing but the celiac disease. That includes the D02 as well as DQ8, DQ2 and DQ8. This is nothing but the gluten sensitivity enteropathy. Then comes the chronic active hepatitis. So this includes the DR3. Then comes the dermatitis herpetiformis, that includes the DR3 as well. Next is what is involved is the SL3, the SLE. SLE is also DR3. Then comes Sjogren syndrome. Sjogren syndrome is also DR3. Next is the psoriasis. The psoriasis vulgaris. This is going to be CW6. Next, the pemphigus vulgaris. Pemphigus vulgaris is going to be DR4, DQ1, and then is a bullous. This bullous pemphigoid variant. So this is going to be the DQ7. Next, we are looking at the autoimmune endocrine diseases. Autoimmune endocrine diseases. So this includes there is a type 1 diabetes mellitus as well as a hyperthyroidism. So hyperthyroidism, this is nothing but the Graves. Next is the hyperthyroidism. This is a Japanese. So let's break it down. So here in type 1 diabetes mellitus, this includes the DQ8, 4 as well as 3 and 2, DQ8, 4, D2. Next, in case of the hyperthyroidism, that is Graves, that is B8 as well as DR3. In hyperthyroidism, that is a Japanese. Here it is B35. Next, in terms of the adrenal insufficiency, it is going to be the DR3. Now, next we will look at the autoimmune endocrine diseases and the HLA associations. HLA associations, that is the type 1. The type 1 diabetes mellitus. So what does this include? This includes a DQ8, DR4, DR3 as well as a DR2. Next, let's look at the hyperthyroidism. This is just to recap. In hyperthyroidism, it was B8, DR3. Hyperthyroidism in Japanese, it was B50, 35. And in adrenal insufficiency, it is going to be DR3. Now, we'll be looking at the neurological diseases and the HLA association. So in terms of myasthenia gravis, it is going to be B8, and in terms of multiple sclerosis, it is going to be B16 and the DR2. Now we are going to look at other important HLA diseases. So we are looking at ankylosing spondylosis. This includes the B27 and also the reactive arthritis and the psoriatic arthritis. That includes also the B27. Now let's look at the Behçet's disease. The Behçet's disease is a B51. Then comes the congenital adrenal hyperplasia. That involves the P47. Next, looking at the narcolepsy. there is a DR2, so DQB1 602. Then there is also the good pasture. Good pasture syndrome is nothing but the anti GBM, and this is the DR2. Next comes the Abacavir hypersensitivity. This is the D57, the B into 57.1. Then we look at the hemochromatosis. Hemochromatosis. Hemochromatosis that involves A3. Then comes the narcolepsy. In narcolepsy, there is Q1. Then, in terms of rheumatoid arthritis, there is going to be DR4. Pernicious anemia, it will be DR5. And in terms of the Hashimoto thyroiditis, it is going to be DR3 as well as DR5.